these should be used on all endovaginal and endorectal exams. Guys, this probe right here, transrectal, transvaginal, endovaginal, all the same term, right? So this probe right here is a transvaginal. The transrectal probe, it looks exactly like this, except you see how this probe has a bulb on the top, kind of has that bulb effect. The transrectal probe would be the same size all the way through. Okay, because man, you can use this for transrectal, but the man will go crazy if you put this inside of him. He'll go crazy. I'm telling you, you won't like it, because it's already hard enough to convince them to get the exam done. You know, in some cases they should offer. They should be used with other examinations, which the transducer can come into contact with body fluids. Before use of the cover, gel should be placed in it to prevent artifacts caused by air. Guys, these are our probe covers right here. These are old school probe covers. Sometimes you can just get away with using a condom. That's how we used to do them. At one point, just using a whole bunch of condoms, but these have the same purpose. These look like little condoms, right? So what you do, this is a non-sterile probe cover. We do have sterile probe covers as well. Okay, this is just one version of it. The version that you guys have in clinic, it's a version that already has the gel in it. I couldn't get one in time today, but hopefully I'll show you guys one soon. But this is kind of the old school way. So for those, so all you're gonna do, I'll kind of loosen it up a little bit before I even start, because you want to put some gel in here, guys. Still a transducer. I still need the gel for contact, right? So I'll put a little bit of gel in there, slip my transducer on right here, and then just roll it down, and then it should kind of hang right here. Bang! Now it's ready to do a patient. So let's say, for instance, I was waiting, like my patient, you know, was ready to go, and then, oh man, I had to run back to the restroom. I may cover this probe right here with a glove in the meantime. Like, say for instance, they left for like a couple of minutes. Oh my God. Let's say they left for a minute or two, right? But let's say if they went away for 20 minutes, you know, then I'm just gonna redress it. I'm not gonna use the same one, right? The thing about using these kind of probe covers right here, these latex probe covers, is that sometimes, well, this is pretty strong. They'll break, and sometimes I've even had one of these stuck in the patient. She didn't even get it out the same day. She said she got it out the very next day because she came back. So these things break all the time, which is why we really don't use these kind anymore. Like I said, these are old school, hence why the school has them. Because now they have a new kind where you just it's like a little sleeve, and it's already, like I say, gel's already in. You just insert this into the sleeve. You rip off the front, rip off the back, boom, your probe is covered, ready to go. Okay, that's what you guys will be working with in the clinic. Okay, I just wanted to show you an example of a probe cover. These are probe covers right here. Look like little condoms, or sometimes people even use unlubricated condoms. You know, the reason, funny story, the reason we stopped using condoms is because people would come, the overnight people were still in the condoms. And these are the most horrible condoms, not even lubricated. I was like, man, why are they still in these? And then it was crazy to find these condoms in the dressing room in the morning. Boy, it used to be bad. So then we had to start locking the dressing rooms from the people that worked overnight. It was insane. So now we have good probe covers that they can't use. Okay?
When do you use a sterile versus
If the patient is isolation, I'm going to use a sterile. Or if somebody happens to have like if I'm on a person's mucous membranes, they've already broken the skin. Like even on a regular transducer, if I'm doing an open wound, then I'm not just gonna put my transducer on that person's open wound, like somebody with a diabetic ulcer on their leg. I'm not just gonna put that I'm gonna have a sterile probe cover. Like you go to surgery, like you're in surgery, the doctor hold the bag, the probe cover open for you. It can be a glove, guys. I use a glove all the time, just like I just showed you guys. I use a glove all the time, just like who did I make a stand-up pad for today? Remember, did y'all see my stand-up pad with the glove in the water?
Oh yeah.
You remember that? That's all I made a stand-up pad with the glove. So I can do the same thing with this. I can put some gel in one of the fingers of this probe right here. Bang. Now I'm ready to go. If I don't have if I'm just down on my resources, I don't have a probe cover, Bang, I'm ready to go, man. I'm ready to work right now. Gel in it. It's ready. It's ready. You know, so sometimes you gotta be creative, but they already have sterile probe covers and sterile gel in the department ready to go. So if you happen to need to use that, like on an open, somebody may have an abscess inside of the vagina or something like that, you know, you may want to use a sterile probe cover. And we do have those. Like on a biopsy, anytime you go to surgery, you're going to use a sterile probe cover. If you do an amniocentesis, paracentesis, you're going to use a sterile probe cover. Okay? So that would be the time we use it whenever you're dealing with open wounds or something like that. Something that finds sterility. You know, you're my surgical tech. You tell me. Okay? So let's talk about the proper disposal of examination waste items, guys. These two things right here, this soil linen bag and this biohazard can, they're in every single ultrasound room. Every single ultrasound room. All waste material should be placed in an appropriate container for disposal. Follow your institution's guidelines for disposal. Typically, items visually contaminated with blood or other bodily fluids must be placed in the biohazard waste bags. So guys, when I finish with my exam, the patient gone, they drop their gown on the bed, I'm gonna grab out the gown, all of that stuff up, boom. We're gonna throw that all in the soil linen bag because it's already used linen so they can take it to get washed. If that person just happens to be, I don't know, a woman there for menorrhagia, she has heavy bleeding on her cycle, left a lot of blood on our bed or on our sheet, you throw that sheet in a biohazard. Same thing with that probe cover. When this probe cover comes off, you don't just throw it in the trash. You put the probe cover in a biohazard bin. Okay? Put that probe cover in a biohazard bin. Okay? Anything that touches bodily fluid should be placed in a biohazard bin. Okay? So again, our linens in the soil linen, unless it's bloody, then we even linens place in a biohazard bag if it's bloody. Don't ever put sharps or needles in the biohazard bag. It's a sharps container in every room as well. So make sure you put stuff in the appropriate place. Okay? And like I said, those are in every room. Most of these have tops on them, so they're not just exposed open like that. A lot of them have, you know, like a garbage can, like a top on it. Okay? So what happens if you were exposed? Guys, be aware of infection control plan in the clinical setting. If you are exposed to an undocumented airborne disease such as TB, your employer is obligated to notify you. Let's say, remember I told you guys, I had an accidental exposure one time to TB, right? I did a patient, nobody knew that person was positive for TB. The next day, or not even the next day, it was like the next week or so, they came and said I had a possible exposure to TB. I had to go get another TB skin test, I had to get a chest x-ray. The facility, the institution is going to do everything they can to make sure, you know, to take care of me. Okay, it's their obligation to notify me that I've been exposed to that. Okay, the facility will most likely want to monitor your health over time. So it's not like it's a one-time deal. They may ask you to do another, like now they do 2 TB skin tests right now when you get hired, right? Okay. If you receive an accidental needle stick, report the occurrence immediately, guys. A needle stick is like so serious. Like it's just a series of patient falling, just a series of washing your hands. Those are like 3 things I'm always talking about, right? Needle stick is just that serious. You happen to get a needle stick, or hopefully you're not that close to be stuck by a needle, but just always be aware when needles are moving around you, because sometimes people move around real careless. Okay? That's all I got for you guys. I got one last video right here. Stop hating.